Good evening, class. My name is, again, Janay Klein, and I originally am first planned to start my internship at Payne County Department, which is in Stillwater, Oklahoma, and that's where the office is located. I wanted to go there to begin with because I had shadowed for Lincoln County, which is the county that I live in. It was like 2021, and I wasn't very fond of how that particular agency's organization was and how they had everything set up. And to me, I just knew that it wasn't the structure that I needed. So I was thankful to get accepted into Payne County Department of Human Services, and my aunt works there as well as a CPS worker. She's awesome, and not that I see a lot of people too, because teleworking is like, it's pretty, not necessarily big, but most of them prefer to telework unless they have to have meetings like in the office and things like that, which is really cool. I love doing that. But I drive about an hour every day to the office. It's not too bad. I'm not a morning person, so that extra hour I could be sleeping, but I try not to think about it. The department is lovely, and their mission, I want to say, is kind of what you would see for most missions anywhere else in the range of being a social worker. Their mission is primarily to promote the safety and independence and well-being of Oklahomans. And I actually did quite a bit of research. I really tried to find research in their mission statements from when that department first opened. I believe it was like late 1920s, early 1930s, it really surprised me. I've read a lot about the history of being a social worker and the dynamics and how it's grown just from like the health side of it to all of these organizations, which is really cool to read about because you can see that one specific department and its growth as to where it is now. And it's one that I'm working at, so that was also cool to do research over. So here's a little bit about the history, and part of the history kind of plays in with a mission statement that I had just previously mentioned that when I get to it, I'll read the history's mission statement of the department. So the department has used a mix of state and federal money and mandates to eliminate a tremendous amount of poverty in the state. Starting in the 1950s, federal requirements and legislative transfers expanded the department into an umbrella agency for healthcare, social services, vocational services, income, and maintenance programs, which is absolutely amazing because the work that is done by healthcare agencies, schools, human services, it's amazing to see not only these organizations independently work, but come together, which I didn't realize how many different agencies came together in the Department of Human Services and working together on cases. It was really cool. I've gotten to watch some MDTs and forensic interviews, and those are cool. So I can definitely see how it was important for the Department of Human Services and the agencies within it to grow and expand. So it's cool actually getting to see that, but also reading about it. And throughout Oklahoma's history of providing public assistance, my thing messed up. I apologize. Throughout Oklahoma's history of providing assistance to citizens in need, the department pioneered work programs for welfare clients in 1965. The agency used concepts from the Federal Emergency Relief Administration of the 1930s to model its work with training programs. Oklahoma was the first state in the nation to require mothers with children under the age of 6 to register for job training under a waiver of federal AFDC regulations. And it was among the first to implement the JOBS program, JOBS program, under the Family Support Act in 1988. Now I'm going to talk a little bit about the 1930s history and the 1930 mission statement, which I'm really excited to be able to share. So this is the mission statement in 1930s that I found on a newspaper clipping in a resource library. Using the internet, I was able to go in and view this log of PDF clippings of those newspapers, which is really, really cool. So the 1936 mission statement of the Department of Human Services in Payne County stated, activities will be wholly in the direction of disease prevention. At no time will the health workers enter into competition with the local professional men. In addition to giving serum to immunize children and other communicable diseases, health officers will give lectures on health education and sanitation. Dr. J.F. Hackler on the occasion of the opening of the first health department in Payne County. So that was their mission statement in 1936. That was really cool to be able to share with you guys. So in 1936, some of their essential services was control of communicable diseases, sanitation of milk, water supplies, and proper disposal of sewage, maternal and infancy services, an effort to lower the mortality of mothers at childbirth and to lower infant mortality, school hygiene and examination and recommendation for correction of physical defects and handicap of school children, and public health education to give people proper information on prevention and control of diseases. And what I found interesting was when I was reading these mission statements and services throughout the decades, I could see how they would add these different branches of agencies, because right now in the 1936 services, it's primarily health services because they haven't expanded that far yet. So when I was reading it, it was kind of weird because when you talk about the department and agency I'm at, it's not necessarily the Department of Health, Human Services. It's the Department of Human Services. But this is where they originated from, was the department that it was health. It got quite confusing for me to differentiate, but it wasn't necessarily differentiating. It's just what it was at the time. And here I'm going to talk about a little bit of the 1940s and 1950s history from the department. These are also news clippings. January 15th, 1941, the news press published that health offices asked for laws for food handlers, a standard ordinance for food handlers prepared by the United States Public Health Services will be recommended for Stillwater by the county health unit. In May 23rd, 1942, the town of Cushing, Cushing is in Payne County, got its first full-time county health office. February 4th, 1948, there was a health clinic banquet held in Stillwater with 250 guests. The banquet was a project to raise funds for speech and hearing clinic for children in the region. And then this is where I believe it was no longer just health specifically. In 1948, they started to branch out to hearing for children and speech impediments and things like that. And then April of 1948, the health department got their very first state car, which they had a photo of it in the news clipping, and it was really cool. It was like If you've ever seen Ghostbusters, the very first one where they have that car, it's kind of almost what it looks like. It was really cool. So today I'm going to give a little bit of information about the services that the department has. So if you go to the Oklahoma Human Services on the website and search for Payne County, you'll be provided a list of services directly in that area. So you can search for Cushing, you can search for Stillwater, you can search for different towns that is within Payne County related to the Department of Human Services they provide. Some of the services and organizations that they provide is food pantries, Thanksgiving basket, rent payment assistance, electric service payment assistance, utility assistance, water service payment assistance, holiday gifts and toys, inpatient substance use disorder treatment facilities, gas service payment assistance, low income rental housing assistance, general clothing provision assistance, homeless shelter, inpatient mental health facilities, donation drop-off points, food stamps, also known as SNAPs, 911 services, transitional housing shelters, domestic violence services. They have domestic violence shelters, and they have a domestic violence hotline within Payne County, which I think is really cool. DUI offender programs, electric payment and plan assistance, substance use disorder treatment programs, crisis shelters, household goods, temporary cash assistance, also known as TANF, excuse me, services for persons with developmental disabilities and persons who are aging, adult protective services, child welfare programs, child support services, child care assistance, license and monitoring. DHS also handles applications and eligibility for Care, the state's Medicaid program that offers health care to families to low incomes. I kind of also get myself confused on these things because I know that a lot of agencies provide these specifically, or you're referred to organizations specifically that provide those services. So like domestic violence, the Department of Human Services doesn't necessarily provide a specific service, but we are referring you to those services or referring clients to those services, as well as being a part of that client help. So but like specifically we offer child welfare programs and kind of like permanency planning. Those social workers also provide interventions that is allowed within their regulations as a social worker. I also know that within the last year and a half, I'm trying to properly word this because I got myself confused. DHS, the Payne County Department of Human Services, has a care portal, and what they use this for is when family needs beds, help with things that DHS can't help with, like I want to say cribs, specific help like with setting up a hot water heater, just something like that, like you need an electrician to come and do those things. They have this care assistant portal that is a separate portal but part of DHS, where we put in a referral and it goes into different communities, churches, partners, and in hopes that a church or someone in that organization gets that request and will assist the family. And I thought that was really cool, and that's something that they had just gotten within like a year or two, year and a half, almost 2 years, and that is something that they have also been trying to work with and remember really using that to help with families, just because those like electric water heater things that we can't necessarily do, we can put in a referral and have somebody help with that. So it was very interesting being able to read the history and get myself even more informed with the types of services that the Payne County office offers. I absolutely love working with this department. Everybody in there, all the supervisors and the teams within those supervisors, it's not just individual. It's not just this is one team and this is one team. Everybody in there is really supportive. They help out. They're absolutely great. The ladies in the front of the office helping clients, they're absolutely lovely. It's all around great. I enjoy being at that specific department, and I am very honored to be there and glad that I got to share a little bit about that department, including some of its history. When they really first kicked off, when they got their first state car. I thought all of that stuff was really neat, and I hope that I was able to provide information that was informal enough for you guys as a class, and I hope that you guys have a great internship and that the rest of your semester goes well. Thank you for watching and listening to my video.